There are growing calls for government to ramp up its rollout of vaccines as it is crucial to controlling the coronavirus as the third wave of infections looms. 4,424 new infections have been recorded in the country in the past 24-hour testing cycle, bringing the cumulative number of cases to over 1.6 million. 93 more people have succumbed to COVID-19 related complications, and this puts the total number of deaths at 55,802. While government has started the second phase of its vaccine rollout, with people over the age of 60 being vaccinated, it has not been without its logistical challenges. Cabinet has also expressed concern over the recent increase in the number of COVID-19 infections and says government is now consulting on the best response, with President Cyril Ramaphosa expected to address the nation soon, to quote them. To further discuss this and other COVID-19 related developments, we are joined by medical expert and higher health CEO, Professor Ramneek Ahluwalia. Good to have you, Prof. Thanks so much for your time.
Good morning, Leanne, and good morning to everyone. Thank you for having me.
Pleasure. So let's quickly get into your thoughts on the latest trends in terms of the reported numbers that we are seeing, obviously above that 10% mark, which I know the alarm bells start going off. But talk to us about what you're reading into these numbers.
So I think definitely we're at the brink of the third wave. We might not be classifying ourselves into the third wave as per the definition of when you label yourself that you are in a third wave. But I think what we've seen in the last few days and the numbers that have been coming out with about 4,000 plus people becoming positive on a daily basis, is clearly it's absolutely worrying. And it indicates to us we are just entering into a third wave. And what does that mean is, it means that there are three key factors for us to watch out. The one is behavior is not being followed, and exactly what the virus wants. The virus wants to move from one human to the other. That's the only way it survives. It enjoys the human body. It keeps moving from one person to the other. And if we allow this virus to keep doing it through our behavior, the virus starts spreading faster, starts spreading quicker, and that is exactly what we started experiencing. So behavior is to be watched. The second big thing is seasonal. We are in winters. As much as this virus is non-seasonal, we've seen a huge pandemic of this or epidemic of this virus in India, which is in its summers right now. Mm-hmm. But winters favor every virus, and predominantly viruses which are spread through droplets or respiratory or are born through moving through aerosols, is the fact that we are in closed rooms, we close our windows, we are going to be inside in congregation with many people together, and that's exactly how the virus loves to move. Mm-hmm. But the third one, which is going to be the most worrying one, is the mutation of this virus. So far, what we have seen is old variants, the variants that were detected in South Africa, or the variants that were already in South Africa, are the reasons of this spread. So it's more related to behavior, it's more related to people now in congregation or fatigue happening. But the question that we need to watch out is the mutations. The virus keep on mutating. The virus will keep mutating. That's how the virus survives. All virus does is finds human body, tries to sit in one chronic human body where it starts to mutate, starts to escape antibodies, starts to defeating the natural immunity of individuals. And that's what, when the virus changes its shape and color, is where we start seeing outbreaks, where we start seeing high transmissibility, or we sometimes start seeing high pathogenicity of this infection. Mm-hmm. And that is what we need to watch out in the third wave. And that decides the fate of the third wave. All right. Whether it's going to be a milder wave or a stronger wave.
So let me throw a couple of questions at you from what you've told us, these reasons. So very quickly, what defines a third wave? When do we know we're in that third wave? Because we've heard some provinces like Gauteng, I think the Northern Cape, the Free State, saying that we are in the third wave in those provinces, but not necessarily nationwide. So what defines a third wave?
So the third wave is defined by definition as when, for 1 week consecutively, you start seeing infection rate 30% of the peak of the last wave. So when the second wave hit South Africa, the peak was predominantly estimated to be around 18,000 people were becoming infected. These are tested numbers, people who test. There are many people who do not test and are asymptomatic or mildly symptomatic, and we do estimate those numbers too. But from the testing rates, when you see 30% of those people becoming positive, from the peak of, so it's 18,000 in the second wave, we're looking at around 4,500, around 30% figure. And if this continues for 7 days, we label ourselves into third wave. So we're not in the third wave as per the definition, but we can clearly see ourselves moving into the third wave. So we at the brink of a third wave.
Yeah, I mean, and that's something we need to be very, very aware of. And behavioural, as you say, is one of the biggest problems because, if you look around, people are, they're carrying on as if we're not in a pandemic, and that's what I'm witnessing, and I hear that from a lot of other people. But Professor, the other question I need to ask you is that, 3 weeks ago we came out, the government came out telling us that the variants and mutations that were first discovered in the UK and India had been detected here in South Africa. I think we'd only been, at that stage, there were probably about 2 or 3 cases, somewhere around there. Do we know more? Do we know what the mutation is currently in South Africa? Are there more that have come out, or is this still under examination? Because I'm believing it takes quite a bit of time to determine what the mutations actually are.
So the major variant in South Africa is still the variant that was detected in South Africa. We call it as a 501 version 2. And that caused us the havoc in the second wave in reality. The original COVID that came to South Africa caused us the first wave. So when the first wave happened, people developed natural immunity because many people became infected in the first wave. People who we know were tested, and we know them, but there were many with asymptomatic and mildly symptomatic. One thing that we need to know is this virus doesn't spare any human body. Whether you are young or whether you're old or whether you are with comorbidity or without comorbidity, including now children. So the virus virus needs a human body, irrespective of who you are. So it keeps moving. And when it enters, a body produces an immunity. So in the second wave, we saw the 501 version 2. We already had the variant found and detected in UK in South Africa then. Yes, the variant found in India called the double mutant, and it's just a misnomer, but that variant is also in India and in South Africa. But these all mutations are quite kind of similar genetic sequencing to the variant that was in South Africa, which means that the natural immunity produced through the variant in South Africa should be able to fight for other variants that are coming either from India or UK. What is any other mutation that we have not yet picked up or is still evolving or is going to happen, where it's going to start escaping these antibodies or these immunities that have been produced from the variants that are already in this country and has infected people and produced immunity. And that's the worry of reinfections.
Yeah.
How long those immunity that produced, whether through natural immunity, can survive us as humans against these new mutants that will evolve and will come to our shores one or the other day, or will get evolved in our own country eventually. Because and that's what we're watching in the third phase.
So many people are calling for stricter restrictions, and when we talk to perhaps, tightening up border control, maybe preventing large gatherings, curfews, things like that. Those are the things that people are speaking to. I know the liquor ban is always a very tough one to talk to, so we won't go there. We'll just talk to what we can control. But even if, in terms of closing borders now, many people are saying it is way too late. If that's the route that we go, I mean, whatever is here, and it's circulating. Do you agree with that train of thought?
Leanne, I have a slightly different view, and I tell you why. Leanne, this virus is kind of becoming endemic. When you have a virus which is bound to stay with you, with the humans, not like it came and will go away. One needs to start learning to live with this virus. I agree with the restrictions and the people calling out. Now, when we as humans, and through your media channels and through everywhere, we just want to send 3 important messages. One is behavior, wear masks, But that's the only way we can stop the entry of this virus moving from one body to the other. That's what the virus wants. The second thing is ventilate. These winters, wear your blankets, wear your jackets. But when you are meeting people, you meet in open spaces or in rooms which are well ventilated or open windows, because the droplets tend to move and stay in air for a while when you're talking to each other. And the third critical element is that we have to maintain distance. And we congregate, we partying together, we with alcohol, we hugging people, we shaking hands together, we family, we believe we are friends. That's not working. This is absolutely against this virus.
Yeah.
That's what exactly the virus wants.
Yeah.
So restrictions are only when we as humans are not following what we are trying to address to the people, and there's no other choice for the government is to put those restrictions. Now, when the card comes, the only advice will be is anybody coming from overseas, because of the variation, the mutants that we are talking about, the stricter law needs to be about the compulsory or mandatory 14 days or 10 days quarantine, a testing during the quarantine, daily screening of these individuals, because this is where you need to make sure that you are not allowing another variant in South Africa, and you're not allowing more burden of people becoming positive into our own health system.
Yeah.
And I think we need to watch out.
And that's the big problem. I mean, we've seen incidences of people coming to South Africa, landing, and within a couple of hours are out and about on the streets. No quarantine, nothing like that. And you know that we've put that to the minister, and gotten a whole bunch of reasons as to why that happened, which, to be honest, were not good enough. While I've still got you, I don't want to ignore the vaccine rollout that's been happening right now. I know I've got to let you go in a couple of minutes' time. The vaccine rollout, less than 1% of the population has been vaccinated to date, and obviously we saw at first the Johnson & Johnson trial taking place, so we saw just under 500,000 people being vaccinated. That's only one shot. However, now we're into the Pfizer, which is 2 shots, and it's picking up pace. It certainly is picking up pace. But what are your views on this? How are we doing? I mean, this can't possibly stop a third wave, because we're already at the cusp of it. Well, not the cusp, about to get into it, and this vaccine rollout, it can't come fast enough. But talk to us about it.
I think there is no doubt. We've seen in the parts of the world which have vaccinated far more than what we have done in South Africa, vaccines have shown effectiveness. There's clear indication. Vaccines do not allow you to go into hospitalization or severity of infection. There are very few of them eventually go into. In fact, they're very, very strong, because the immunity vaccine produces is far stronger than a natural immunity is produced once the virus enters your body, and gives you a very holistic kind of an immunity. And what we've seen with India, as an example, let me quote this, is India did not vaccinate the way their vaccination program, because the population is too high. And what we saw was that their second wave came parallel to their vaccination program. And what happened was, when the hospitals started becoming overburdened with lots and lots of hospital admissions because of non-vaccinated people, or people with no immunity started coming, or living with comorbidity started coming to the hospital, the whole vaccination drive program collapsed parallelly. Because you're vaccinating in the same hospital, you're using same nurses to do that. Now, how do you cope in that mechanism where you have a huge overburdening of hospitals, and you also having the vaccination drive? And it does compromise. And that's what we as South Africans need to watch out. We need to learn from India as an example, to say we have the similar situation. We are now picking up our vaccination program, and parallelly, we have a looming third wave just at the corner of us. And now we need to be very strategic. And for me, this is where the time of behavior change, requesting people to follow the guidelines of what we are telling them, putting restrictions from government might be of some importance, and very critical importance at this stage, because what we do not want is overburdening our hospital system to also compromise our vaccination program. And even if that third wave hits us and overburdening our hospitals start happening, we need to ensure that the vaccination program does not get a knock. And that is where the strategy needs to be, because vaccination is the most critical element at this moment should we want to have an environment where we can control over this virus rather than right now the virus controlling us as humans.
Indeed.
And so the weapon we need to work parallel. And that's the worry we have at this stage.
Prof, you need to go. You've got another interview. Thank you. Thanks very, very much for your time. Always a pleasure speaking to you, just putting it into simple terms that all of us can actually understand what's going on. So we do appreciate you being with us this morning, as always. Professor Ramneek Ahluwalia, who is, of course, the medical expert and higher health